Most people believe that diabetes can only be detected through a blood test. You visit your doctor, get your lab work done, and only then do you find out. It's easy to understand why this belief is so common. For years, many people have relied entirely on test results to reveal what's happening inside their bodies. But what often goes unnoticed is that the body starts sending warning signals long before any lab result confirms a problem. These signals are subtle, easy to ignore, and often misunderstood. One of the very first places these warning signs appear is in the feet. Many individuals go months, even years, experiencing these signs without realizing their significance. By the time they finally discover the truth, the condition has already progressed. The reality is the body is constantly communicating. The challenge is learning how to recognize and interpret those messages before it's too late. There was a case of a 67-year-old man who appeared healthy and had no major complaints. He came in for a routine checkup, expecting everything to be normal. But before any tests were conducted, a simple question about his feet revealed something important. He mentioned experiencing occasional numbness, something he assumed was just a normal part of aging. However, this seemingly minor symptom turned out to be one of several warning signs. When his blood sugar was tested, the results were alarmingly high, confirming diabetes that had gone unnoticed for years. This situation is more common than people realize. Millions of individuals are living with undiagnosed diabetes, unaware that their bodies have been signaling for help all along. One of the earliest and most commonly ignored signs is tingling or numbness in the feet. Many people describe it as a pins and needles sensation, or say their foot simply fell asleep. While occasional numbness can happen to anyone, frequent and unexplained episodes are a different story. This sensation is often caused by nerve damage resulting from prolonged high blood sugar levels. The excess sugar begins to damage the protective layer surrounding the nerves, disrupting the signals they send to the brain. Over time, these signals become distorted. What starts as mild tingling can gradually develop into persistent numbness. This process happens slowly, which is why so many people overlook it until it becomes more serious. Another common sign is a burning sensation in the feet, especially at night. Many people assume it's due to fatigue or being on their feet all day. However, when this burning feeling occurs regularly, particularly when trying to rest, it may indicate nerve damage. The nerves begin sending incorrect signals to the brain, creating the sensation of heat even when there is none. It's similar to a malfunctioning alarm system that goes off without any real danger present. This discomfort can disrupt sleep and significantly affect quality of life. More importantly, it's often one of the earliest indicators of underlying blood sugar issues that need attention. Slow healing wounds are another serious warning sign. A small cut, blister, or sore that takes longer than usual to heal should never be ignored. Many people assume it will eventually improve on its own, but that isn't always the case. High blood sugar affects circulation, reducing the flow of oxygen and nutrients needed for healing. As a result, even minor injuries can linger and become vulnerable to infection. What starts as a simple wound can develop into a much more serious condition if left untreated. This is why paying close attention to even the smallest changes in the feet is so important. Changes in skin color, particularly around the feet and ankles, can also signal a problem. Some individuals notice darkening, redness, or even a bluish tint in these areas. While it may be dismissed as a natural variation in skin tone, it can actually indicate poor circulation. When blood flow is compromised, the skin doesn't receive enough oxygen. This lack of nourishment leads to visible changes that serve as a warning sign. These changes often develop gradually, making them easy to overlook. However, recognizing them early can provide valuable insight into what's happening beneath the surface. Persistent dryness and cracked heels may seem like a simple skin issue, but they can be linked to nerve damage as well. The nerves responsible for regulating moisture in the skin may stop functioning properly. As a result, the feet lose their natural ability to stay hydrated. Even with regular use of lotions or moisturizers, the dryness persists because the underlying issue isn't being addressed. Cracks in the skin can become entry points for bacteria, increasing the risk of infection. This makes proper foot care essential, especially when these symptoms are present. Swelling in the feet and ankles is another sign that shouldn't be ignored. While occasional swelling can happen due to prolonged standing or sitting, consistent swelling may indicate deeper issues. High blood sugar can affect kidney function, leading to fluid retention in the lower parts of the body. This results in noticeable swelling that may leave marks on the skin, such as indentations from socks. This type of swelling is more than just discomfort. It's a sign that the body's internal systems are under strain and need attention. Sharp, stabbing, or electric-like pain in the feet is often mistaken for conditions like arthritis or past injuries. However, this type of pain can be caused by damaged nerves sending erratic signals. Instead of becoming numb, some nerves become overactive, triggering intense sensations without any physical cause. This can be especially noticeable at night, when there are fewer distractions. Pain relievers may temporarily mask the discomfort, but they do not address the root cause. Understanding where this pain is coming from is crucial for proper management. Cold feet that persist regardless of temperature can indicate poor circulation. Even in warm environments, the feet may feel unusually cold due to reduced blood flow. Another subtle but important sign is hair loss on the feet and lower legs. Hair follicles require a steady supply of nutrients and oxygen. When circulation is impaired, they stop functioning properly, leading to gradual hair loss. These signs may seem minor on their own, but together they paint a clear picture. The body is signaling that something is wrong. Taking a few moments each day to check your feet can make a significant difference. Early detection allows for better management through simple lifestyle changes and medical guidance. Paying attention now can help prevent more serious complications later.